And I think where we need to move in this country is looking at what does healthcare mean for us as a people, as a community, and as a society. Where does this fall? And I think one of the things when we talk about single payer, there's so many misunderstandings about what single payer could do and specifically what it would not do. And I think there's this fear of an overreaching government. We see this now with the Affordable Care Act. We see a lot of rhetoric about Obamacare, a government takeover of healthcare. And really, when we think about it, who is taking over our healthcare in this country? And what are their motivations? And how are we able to get information from them about the care that we're receiving? When we look at the 40% of people in this country who get employer-sponsored insurance, it's not even the majority, actually. Only 40% of people actually are on employer-sponsored insurance here. You largely do not have access to the pricing or the costs of the care that you receive. That's all confidential or proprietary information. So the idea that healthcare is a commodity, like buying a car or a house or something like this, is disingenuous because I can actually find out how much a car costs in several different settings. I can compare lots of different things, but I can't do the same thing with my healthcare. When I don't know how much my hospital stay will cost, I don't know how much my prescriptions will cost, and I can't get anyone to really give me an honest answer about what all of this will mean out of pocket, then that removes me from being a smart consumer. So we have one element of our political system or our policy world saying that I have to be a smart, responsible individual consumer of the products that I purchase. And I would be okay with that if it wasn't inconsistent that I didn't have the access to the information that would allow me to make a smart decision. At the same time, we know that people don't make rational decisions when they need health care. And that shouldn't be something that I'm left to negotiate with someone on an individual basis if I am in a position of being ill. So I think we can all appreciate how that's an unfair system. When we think about where we want to go with our inconsistent economic principles, we say keep government out of my health care. And yet I think it was, I'm just looking at my notes here to make sure I'm giving the right piece, $160 billion were spent in 2010 at the federal level to offset the costs to my employer for my insurance. So the 40% of people who receive their health care from their employer in this country, the people who are privately insured and are generally the people out with signs that say, keep government out of my health care, government is already heavily subsidizing the health care that you receive. And so if we want to be consistent in the economic principles that we're putting out about healthcare, then I say if we really want to, if conservatives would like to remove government from their healthcare, then we need to be taking back $160 billion that helps employers provide that very health insurance. And when I talk with employers, if you talk with small business employers and ask them, do you like having to provide healthcare? Is this something that you want to be in the business of doing? Universally, employers say, no, I'd really rather not. I'm in the business of making cars, or I'm in the business of doing, running a restaurant. Doing these kinds of benefits actually is quite expensive. It's a real hassle, and it's something that's just not sustainable for a lot of small businesses. Large businesses really don't even like doing this. So I really think that we need to listen to our business community and think about, does it matter where my health insurance comes from as long as I as an individual am able to get the care that I need? When we think about the inconsistent philosophies that dovetail with what kinds of benefits that I get as an American, as a resident of the United States, it's always struck me as curious that we are absolutely fine with universal education for all of our children, mandatory education for all of our children, K through 12 education. As a parent, if you don't send your kids to school, you get charged with truancy. And we seem fine with this. Now, I would certainly not argue that there are no problems in the education system, but in terms of access, in terms of the principle of universal importance of education, why is it that that doesn't extend to healthcare? Why is it that we seem to be pretty square as a society with our police and our fire and our public libraries, our road maintenance, all of that coming from our taxes, from a system of government-sponsored provision of services. And this is something that we come to expect. If you ever want to see an absolute community outrage, try closing a library or a police station or a fire station. Try not fixing the roads. These are things that people come to expect as being a member of our community that we all pay into. And so when we look at what our taxes pay for, when we look at our expectations, why is healthcare different from these other very basic provisions of a community? This has always struck me as odd. And I think certainly we have a private education system that, as a parent, if you would like to pay for extra or pay for something different, that's certainly your right to do. And I think a single payer model could allow for people to be purchasing additional benefits or additional riders at their own discretion. But why is it that, much like education, we don't have a basis, a fundamental basis for everyone who's here for accessing that? And why is it that we don't see that as a fundamental part of a healthy and strong community? These, again, are just the inconsistencies that I see in the arguments that are made against single payer or against any rational healthcare system. When we think about how we argue for the sanctity of the private market model, and how the market will fix whatever might go wrong. And if you believe that, then why is it that we then, on top of that, specifically insert into our healthcare system provisions that go against the private market economic model? For example, we have prohibited Medicare from doing bulk negotiating rates on prescription drugs, which is precisely the kind of economic model. When you purchase in bulk, you negotiate for a lower rate. These are very standard economic principles. And yet, when it comes to healthcare, we've ensured that we're not allowed to do that, so that we can keep the prices high and that the pharmaceutical industry can ensure that it meets a margin of profit. Now, I'm certainly not against companies being profitable. I'm certainly not against people being successful. But when it comes at the expense of affordable care, when it comes at the expense of needed care, when it comes at the expense of a rationally organized healthcare system, that's where I start to see an interference in the way that my health then becomes profitable for someone else. Specifically, denying me health care then becomes profitable for someone else. And I think that's where we need as a society to take issue with that. When we look at where we want to go now, currently we've just spent 3 days arguing in the Supreme Court where we want to go with the Affordable Care Act. For better or for worse, the Affordable Care Act absolutely tries to move this system in a better direction. And so for that, that's a great thing. But at the same time, it still falls short. What people aren't talking about with the Affordable Care Act is the 20 million people that are anticipated to remain uninsured even after all the provisions go into effect. We have 50 million people who are uninsured now. We cover about 32 million of them. So, I mean, roughing it out, we still have 20 million people. We've done just about half, but we haven't finished the job of actually extending health insurance to everyone. So when we think about, again, just the gaps, we look at the Affordable Care Act, which has established finally at least a national consistency on eligibility for Medicaid, which is a needed thing. What we see then when it comes to the benefits is back to a state-by-state interpretation where I, as a person living in Maryland, have access to a different benefit system than someone in Nebraska or Montana or California. And I assert that health care is something that is a right, is a human right, and is something that I should be able to move here, there, and the other and make sure that my health is consistently spoken for and protected everywhere I go. And so, again, these are some of the things that are the inconsistencies in the Affordable Care Act that I think are of concern.